as you know, the numbers of the COVID-19 infections are rising steadily. Now, 2 students of the Xavier Minor Seminary have tested positive for COVID-19 and are receiving treatment at the Upper West Regional Hospital's treatment center. 34 other students have been quarantined in one of the dormitories of the school. Rector of the seminary, Reverend Father Pamphilio Tengan, urged parents who have their wards there not to panic, as the situation, he said, is under control. Correspondent Rafiq Salam will be joining me shortly live from Wa, but first, here is a report he sent earlier.
Authorities at the Xavier Minor Seminary stood motionless and in pensive mood. Their thoughts and prayers are with 2 of their students who have been reported to have contracted COVID-19 disease and recuperating at the Upper West Regional Hospital's treatment center. Rector of the Xavier Minor Seminary, Reverend Father Pamphilio Tengan, recounted what transpired.
It is true that 2 students have been confirmed with COVID-19 in the seminary. One of them complained about ill health and was sent down on Monday in the night. He was given treatment and returned to the school with the priest that sent him down. But then in the evening of Tuesday, a team came from the Municipal Health Directorate that they had tested our student and he was positive, and they were coming to send him to the isolation center. They didn't want to bring in the ambulance here to frighten the other students, so we had to get the student out of campus to join the ambulance and go to the isolation center. That was on Tuesday night. Yesterday in the morning, another student reported to the clinic and with symptoms. So I drove him down to the municipal hospital. He was tested and he was confirmed positive also. So the 2 are now at the regional isolation center.
The 2 students hail from the Wa municipality and Hamble in the Lamuse district. One of them had a family member he was close to who one time tested positive, but he did not.
One is from Wa. The other one came from Hamle, but is from Burkina, but he has relatives in Hamle and Tamale. So from Hamle, he traveled to Tamale before coming back. And he already had a member in the family who tested positive. And they tested him and he was negative. And when he came, the signs then came up and he was confirmed.
Reverend Father Pamphilio Tengan said 34 students who came into contact with the 2 students were counseled before being isolated in 2 separate dormitories. He called on parents who had their wards in the school not to panic as they are in control of the situation.
Luckily for us, the Deputy Regional Health Director for Public Health, he was here with our nurses and the other team members, plus the Catholic Executive Health Director. We spoke to the students on the need of isolation, and right now they are in their dormitories. They are not mixing with the students.
Upper West Region's Director of Health Services in charge of public health, Dr. Richard Wudasemi, who visited the school, commended the students for their cooperation, pledging that they were not going to leave any stone unturned in their bid to fight the disease.
We can for now say that the 2 cases do not appear to be epidemiologically linked. They may have contracted the virus from different environments, and so we are looking at that possibility. We would be establishing that in the coming days. But to break the transmission chain, we have identified the quarantine center as spacious enough that will be able to accommodate all those who came into contact with the 2 positive cases. The contact listing has been done, and a number of the students have been identified, and since yesterday they have been in quarantine.
Authorities at the minor seminary here have allocated 2 structures, one in front of me, another one behind me, to take care of the 34 students that they think have come into contact with the 2 students. In the next few hours, they will move to a much bigger place where it will contain all of them. Reporting for JoyNews, Rafiq Salam. Wow.
Well, that report was filed by correspondent Rafiq Salam, who's now joining me, as I said earlier. Rafiq, let's begin with an update. Is there anything developing on the back of this story?
Latest news regarding the St. Francis Xavier Minor Seminary has to do with the 2 students who were admitted at the Upper Regional Hospital. And so the latest is that there's a 3rd student that they have tested, and by the results, when came out, it was negative. And so that is the latest. But the 34 students currently are being quarantined at a more spacious, more ventilated place, dormitory at the school.
Let's talk about the school authorities and what they've done on the back of this. Has the place been fumigated? At least, did they give you that information?
Yes, yesterday when the incident happened, the 34 students that came into contact with 2 students were initially isolated and then quarantined at 2 separate dormitories. But they secured a much bigger, more spacious, more ventilated place at the school, and they asked the students themselves to clean it, after which it was fumigated. And so later the students were allowed to get into this particular place. But they have also introduced a whole lot of safety health protocols at the school. The wearing of nose masks at the school, in and around the school, was mandatory. And also, wherever you move into the school, you can also spot Veronica buckets around there. In that school, the St. Francis Xavier Minor Seminary, they have a primary school and also a JHS there. And so, by extension, those students in the premises have also been asked to follow those rules. So they have come out with several measures in order to contain the virus or the disease in the place.
I'm still curious, Rafiq, did they specifically say whether or not they have fumigated the area after this?
What actually happened, I can't say for now whether the place was fumigated or not, but we were told that after they did the cleaning, the place will be fumigated. I haven't gotten that information yet.
Okay.
But the latest information that we can tell you that was about the test student who was tested, whose results have now become negative.
Okay.
And also there are other people in the region in terms of the COVID-19 who have contracted the disease, which we have gotten the latest figures. So let me give you a regional picture of the COVID situation in the Upper West region. We have as many as 161 persons who have the disease, and also out of the 161 cases, we have 38 active cases in the region, and now 4 people are dead from the disease in the Upper West region. So moving to the 38 active cases in the region, 16 of them are from the Nadoli district, 21 of them are from the Wa municipality, and 1 from the Lora municipality. So these are the figures, regional figures in the Upper West region regarding COVID-19.
Okay, I'll say a very big thanks to you. I was just going to go to those figures which you have done already. In terms of adherence, Rafiq, what can you report? to the protocols?
I can report you that in terms of adhering to the safety protocols in the Upper West region, they have been thrown to the dogs. And the people are even doing it with laconic, laconic bravery and sometimes arrogance. You get a place like the War KJT or like the War Market, the people are thrown into the dogs. You can count as many as 50 people. Out of 50 people, one person will be wearing a nose mask, which isn't good enough. Yesterday, I tried to speak to the GPL2 about the situation. They said they were going to hold meetings in the next few days to come out with measures for drivers and other passengers who come into the KJT so that they will adhere to these protocols. But remember, let me also tell you that in terms of the work KJT, as big as the place is, which you can measure as many as about 10 acres, only one Veronica bucket was spotted in the area. About 10 acres wide, only one Veronica bucket and no soap I spotted in my rounds yesterday. So in terms of adhering to the COVID safety protocols here in the Upper West region, isn't the best. Even the other people who are even having the nose masks, but they will not wear. Some riding motorbikes, they prefer to put the nose mask beneath their seats and sit on. And so when they are inquired, when you ask about them their nose mask, then they will quickly remove it and put the mask there. But the people of the Upper West region, what they need to know, what they need now is for the police or other security agencies to come hard on them to ensure that they follow these rules.
And that's one of the, perhaps the final question I'll ask, Rafiq. We've seen in Central Region yesterday there were some arrests in the here in the Greater Accra region. About 2 days ago there were some arrests. Are the police in the Upper West region following suit, or from what you say, it looks like nothing like that is happening?
Yesterday I spoke with the Upper West Region Police Command talking about the public relations officer, Chief Inspector Gideon Boateng. And he told me that the police already are out, they are in town, they are moving from one place to the other, and then they are ensuring that these protocols are observed. But I made him to know that I have been at the market for close about 3-4 hours. I haven't spotted any policeman around that particular area, and he told me that the people are trying to, the passengers or the people in the Upper West region are playing hide and seek with the police. Okay. Immediately the police are spot on. What they normally do is that they put on the nose mask when the police leave the area, and then they will remove it. And so I said yes, the police are doing their best, but the people are trying to play hide and seek with them.
Thank you very much. Rafiq Salam joined us from Upper West region, where 34 students at a seminary have been quarantined. 2 of them have tested positive for COVID-19. Let's move to the Ashanti region, where pupils of Asokori Mampong Roman Catholic Primary School are challenged in adhering to social distancing protocols to beat COVID-19 due to their poor classroom infrastructure. The deteriorated shelter exposes the children to the hazard of crowding in the classrooms. Danaya Ojima reports on this condition. He'll be joining us as well.
2 years ago, a shelter was raised to reduce congestion at Asokori Mampong RC Primary A. This shelter has classrooms, 7 classes 5, 3 and 2. Each class is made up of more than 30 pupils studying in this temporary structure. Portions of the roofing sheets supporting the old wooden walls were ripped off within the long COVID-19 school break. To escape extreme weather, the children get crowded in the middle of the class. Others have to endure extreme heat during afternoon classes. The situation in the school impedes adherence to COVID-19 safety protocols. Deputy Director of the Ghana Education Service, Anthony Boateng, spoke about the state of such school structures.
You know, and as much as we need dedicated teachers and the children to be able to learn, they also need to create a very good working environment for the teachers and the children to teach and learn. There's a need for everybody to get involved. Government cannot do it alone. Individuals cannot do it alone. We need the support and cooperation of everybody.
Across this compound sits another structure for the Asokori Mampong RC Primary B. Conditions here are similar to what persists at the Primary A. Ashanti Regional Minister Simon Osei-Mensah says an action will have to be taken to deal with the plight of the students.
when you identify such problems, we sit down and talk. This is not the last meeting. This is the beginning. At the end of the day, I'll meet with the regional director of Ghana Education Service, who has been very, very cooperative in all these things. And then we identify the problems in general. I don't normally like you solving problems in bits. So we go and sit down. She'll compare all the needed infrastructure in the basic schools. And then we will write a letter to Ministry of Education for solution.
The Efijase Methodist School in the Seche East District of Ashanti had similar challenges. But the fortunes of these students have changed after a family reconstructed a 4-unit classroom block for the school. Thomas Nyakudankwa speaks for the family.
The church showed us a dilapidated building, which was not, it looked like a poultry farm actually when we came and saw it. So we decided that, okay, we will pull it and build this for the kids in the name of our mother. But along the line, in the planning stage, our senior brother passed away, and subsequent another brother also passed away. So we combined the three and said we will dedicate this to their memory. So it's in memory of our mother, Ofuruwa, and our two brothers, I.K. Dankwa and Same Dankwa, who actually was a chief, a sub-chief.
From Kumasi for JoyNews, Nanaya Ojima reporting.
Nanaya is joining me right now from Kumasi. Nanaya, let's take a look at the numbers, first of all, in the region. Let's start from there. What can you report as far as the contribution of the Ashanti region to the national total?
As at the moment, I do not have the specifics, but what the health professionals are telling us is that the numbers keep rising and it is contributing to the fast appreciation of the national figures so far.
We know that not all you pick up in the course of the reporting actually feeds into the final report. Take us through a little bit of the backstory to what we've just seen.
So what is happening at the Asukariman Primary A and B is that the pupils in there are forced to ignore social distancing protocols, especially in the afternoons. When we went to film this report, it was actually in the morning. So the students were not feeling the impact of the extreme weather conditions. But from what I learned in the school, in the afternoons, especially when the sun is scorching, these students have to find a way of escaping the scorch from the sun. So they concentrate at one point in the classroom, and this is contributing to the disregard for social distancing protocols in these classrooms. Other classrooms in the school are also having similar challenges with space. So most of these students in the classrooms are forced to disregard the social distancing protocol, and also the teachers are having a very difficult time ensuring that these students do comply with all the protocols of COVID-19, especially nose mask wearing protocol.
And obviously, this is just one story that represents the story of several other schools. Can you give us a mental picture of the situation where you are?
So in schools like the Opokuwari Basic School, there are similar challenges due to the numbers in these classrooms. What authorities did was that they had to create some sheds or some tents out on the school premises for these students. And most of these students were, the classes were divided with some students learning under these tents. But the objective of to achieve these objectives, because most of the students had to sit close to each other because of the challenge they had with furniture. So even though some schools are making some alternative arrangement, the problem still persists because some of them do not have furniture to encourage the social distancing that they are working to achieve. So if you come to the Ashanti region, most of the public schools especially are having a difficult time implementing all of these protocols, especially social distancing protocols, and also the disregard for COVID-19 protocols on the streets and in the homes are also affecting the observance of these protocols in school, especially when children are commuting to school. They disregard the social distancing protocol and also the nose mask wearing protocols because a lot of the people outside, the public, are not adhering to the protocols.
So looks like same story from the Upper West region. Anaya, thank you very much. Let's take a look at what is happening in the Western region, where Natalia Kwanzaa is standing by for us. Hello, Ina.
Hello, Gifty.
Ina, do you have the figures for your region?
Yes, so currently we have 194 active cases in the Western region. We have the STMA contributing 58, the Efia First Municipal Assembly 12, Taka 5, Wasa East 1, Elembele 1, and then Wasa Amenfi East, Ahanta West, we also have 1. And then when you come to suspected cases, they have 73 of it, and then out of it, they contacted 4 persons. As of yesterday, 21st of January, 3 people had died. This is from the Regional Health Directorate.
Interesting. Very interesting. Now, it looks to me like we can delve a little bit into the dynamics. Ina, the previous time, I mean, the earlier when we started recording COVID-19 cases in your area, it looked as if the Takwa area had a few more numbers than they do right now.
Yes, it have a few numbers now, and the STM, that's the Secondary Takwa Metropolis, is leading compared to this. Yes, but as to why this is happening, the Regional Health Directorate have not stated it. But as we have been talking about for the past weeks, I've told our viewers that people are really not adhering to the protocols, even though that the president has said continuously that they should adhere to it. The police in the region who are supposed to enforce, when I contacted them, they said what they are doing is sensitizing. They are not arresting anyone. They are sensitizing, and they are asking them to wear it when they see you, but they are not causing any arrest. So the whole from Monday to now, what they are doing is sensitization, asking people to wear it. So next week, they'll start the arrest in the Western region.
Actually sounds good and sounds like a plan because first of all, there's the issue about space and where to keep the people who are arrested, because you can arrest as many as 100 people in a day, then you're going to have to make provisions for that. But Ina, how do people feel about the fact that there seems to be a second wave, as we're calling it, which is even harsher than what we saw earlier? If you have had any engagement, with people in the area, how do they feel about this?
Well, people are worried. I mean, you talk to some people and they really seems very worried, especially when you go to our market places. I mean, the central business district, this is one place that people really talk about, that when you get there at this moment, the social distancing protocol is not being observed. The traders in there are not observing the nose mask, the face mask wearing protocol. Hand washing has also become a challenge there. So when you speak to them, they are worried, but there is also a section of the public who believe that this is just a fallacy, it's a mirage, it's just the way some people, they say, want to spend unnecessary money because they think that during the election, in the heat of the election, no one did talk about the fact that there is a surge in COVID-19, but how come right after the election and after Christmas, they are saying that there is a surge? Most people say they don't believe it. Was the other fraction that I have been speaking to also express concern of being very worried.
Anything that our viewers ought to know about the situation in the Western region, do share with us. Otherwise, as usual, that's it for me. Okay, looks like Ina was saying something there. Ina, are you saying something? Okay.
No, Gifty. I said that's it.
Very well. Thank you. Natalia Kwanzaa is our Western Regional correspondent. As you heard her say, they have quite a number of cases there, with the Secondary Takwa municipality recording about 194 alone, just that area. And it is actually leading in the region. Let's head to the Bono region. Let's see how what the situation is over there. Precious Semevo is our correspondent. Precious, do you have the figures?
Yes, JT. So, according to the Health Directorate, they are saying that 648, that is the current figure in the Bono region as at now, with only 3 active cases. So out of the 648, we have 3 cases that is being managed by the health authority. Now, according to the Ghana Health Service Directorate in the region, they have new results, new updates that they are yet to channel to the national office. And because of that, they are unable to give those figures out to me. But information I've picked from the directorate indicates that out of the new figures that hopefully by the close of day today or tomorrow thereabout includes 1 death. So officially, the Bono region has recorded 1 death as at now. But as at now, whilst we wait for the new figures to be updated, we have 648 cases with only 3 active cases that is being managed now. Gifty.
Out of these figures, you say, I may have missed it. Did you talk about any death?
Yes, one death has been recorded.
Yeah.
But according to the Health Directorate, that is part of the new updates that they are yet to provide for the national office.
Very well.
So they are waiting to provide that update to the national office. But whilst we wait for that to be done, probably later today, we have 648 active cases, with 3 of them being managed at the health facilities in the Bono region.
Right, just three is pretty manageable. And I was asking the other correspondent about adherence to the protocols, given the renewed attention or the renewed awareness that we're all supposed to be having at this point, and the fact that the President himself has asked police to crack down on people who don't adhere to these protocols. What can you report as far as that is concerned from there?
Yeah, so Gifty, I would say that the adherence, particularly with the wearing of the face mask, it's a bit encouraging. Now, let me explain. I remember during the Unitide, that is exactly about a month ago, I was standing at this same joint, Sunyani, the Central Business District of Sunyani. And if you look around, then the wearing of the face mask was non-existent, I must say. But as of now, I can say that about 7 out of 15 people are wearing their face mask. And I can also see 1 or 2 police officials. Once in a while, they accost people by the roadside and ask them why they are not wearing their face mask. This school girl, about 15, 16-year-old girl, was accosted by the police. And her reason for not wearing the face mask is that she was just sent by her mother to buy something from the Central Business District. So she forgot to put on her face mask. And the police asked her to go back and then put that on. But let me quickly also add that I think the police can do better than what they are doing now. Brought to town, the Central Business District, I was the only person wearing face mask in that car. And interestingly, we passed through a police checkpoint on the Abisim Sunyani stretch, and the police officials were just looking on, and I was surprised. They just asked the car to move. I believe some of them are trying, but a lot more needs to be done by our security people, especially people entering the Central Business District. They will probably have to do more by way of checking those people. But the school children, I must say, when they are in school, it is encouraging. The teachers try their best to manage them. But the moment they close from school and they are on their way going home, it is no one checks them, and they just keep the nose mask beneath their chin. And that is also something that the authorities, the parents themselves, and all stakeholders will have to come on board to ensure that the face masks are worn at any particular time when you are out of your various homes.
Semevo there reporting that it looks like people are taking the COVID-19 protocols a bit more seriously in the Bono region, although there have been a few incidents where people were breaching it. Well, the NCCE has issued a statement. In that statement, they talk about how disturbed the organization is about how we're flouting the protocols. But let me engage Albert Sori, our correspondent in the Upper East region. Albert, let's begin with the figures. I'm sure you have them.
Yes, Gifty. So we have... Hello, Gifty, can you hear me?
I do. Please go ahead.
Yes, so in the Upper East region, we have 89 active cases at the moment. I just checked with the Regional Public Health Promotion Officer, and he gave me this figure. He says that this was actually the figure, the last one that was officially released on the 14th of this month. As we speak, there hasn't been an update from on that particular figure. So we have 89 active cases as we speak in the Upper East region. He also says that this number increased from 33 just before the year began. So it's a very sharp increase if you look at the difference. Now, he attributes this to the fact that previously we didn't have much information coming in as far as the testing was concerned, because they were doing the testing in Tamale and Kumasi. So it took a longer time for the health directorates to be able to get the results of people who were being tested for COVID-19. But now we have a testing center in our regional hospital here in the Upper East. And then at the Nabrongo Health Research Center, they are doing some testing there as well. So they are able to test quickly and get figures. So that is it as far as the numbers are concerned. What he says is that since 14th, he has not had any official figures yet as far as testing and what the latest situation is in the Upper East region as far as our active cases are concerned. But 89, that is what he was able to give me for now.
It's a stark contrast to what is happening in the Bono region, where they have only 3 active cases, but and that's even a figure that has not yet been updated. So it's pretty worrying. Do people in the communities get the sense how dire the situation is?
Yeah, so again, just this morning, I was talking to one of the regional health promotion officers. She actually takes it upon herself to do a lot of education as far as this COVID-19 issue is concerned. Now, one of the things I got from my conversation with her is that even as we speak, there are people in the Upper East region who still think that COVID-19 is a hoax. They don't believe that the virus exists. There are people who think that for them, God is protecting them and there's no way they are going to get it. There are people who only put on the mask when they feel somebody is complaining about it or people are watching. So it's still a very big problem. But generally, you get the sense that people are listening to the fact that they're talking about the fact that the cases are increasing and all of that. But when you go to town, you don't get the sense that people are actually protecting themselves, because very few people wear their face masks in the Upper East region. Now, one of the things from last week that I observed was that the weather last week was very warm, actually. So most people tend to take their face masks off in the afternoon when the sun is warm and they are sweating and all of that. People complain that it becomes difficult for them to breathe easily when the mask is wet from their sweat. So a lot of people tended to take off their mask. Now today, again, I was in town. Today, the weather is hazy because of the Harmattan. There's a lot of dust in the atmosphere. So that is also encouraging, or if you like, forcing people to wear their masks so that they don't necessarily inhale dust. But as far as the issue of COVID-19 is concerned, if you observe in our region, it appears that people are still not really taking it serious. More than half of the people don't seem to be adhering to COVID-19 protocols. And I heard you ask other people about, my other colleagues about the police and
yes,
what they are doing. Again, I was doing some checks. I realized that in the Upper East region so far, I haven't seen police actually taking people on or forcing people to adhere to protocols. This afternoon, I was returning from Sumbrungu, where I went to do a shoot. I got to a police checkpoint on the road, and they were stopping people and checking for whether their motorbikes were registered or not. I was one of the people that were stopped. I was wearing my face mask. The police didn't ask me anything. But there were two women in front of me on a motorbike who were wearing helmets, but they were not wearing face masks. And I did not see the police ask them anything about the face masks at all.
Well, I guess that the helmet covers the nostrils and the mouths.
No, these are the helmets that don't come with the enclosure in front. These ones are just the simple ones. So, their faces were just showing. So I'm yet to see. We have this regional media and police platform. So I'll be engaging the police PRO to see whether very soon they will be going to town and checking on whether people are adhering to protocols. But so far, I have not seen it.
Very well. So far, we've seen some arrests in Accra, arrests in Tema, arrests in Cape Coast as well. We've heard of sensitization first in the Western region, which I think is a great idea. We'll see what Upper West will do. Albert, thank you. Upper East, I should have said. Albert's correspondent for Albert Sorry is our correspondent for Upper East region, where they have 89 cases. We'll be joined by the NCCE, so we find out how involved are they in terms of disseminating the information that is required to create the awareness that we really need to create right now, especially in the regions. But let me take you to Kolebu. The construction of an infectious disease treatment center over there, which is the Kolebu Teaching Hospital, has stalled after workers abandoned the site. JoyNews' visit to the premises revealed key electrical work is yet to conclude. A foreman at the site tells Daniel Dazi the plastering and other finishing works have been held up for that reason. The facility was scheduled to be completed 30 days after work commenced nearly 10 months ago. This has left the 8-bed treatment facility at the nation's premier referral center overburdened as Ghana's COVID-19 case count rises. Here is a report Daniel Dazi put together.
Soon after Ghana recorded its first few cases of COVID-19, it was announced that a 50-bed infectious diseases facility was being constructed here at the Kolebu Teaching Hospital. Close to a year after construction began, this facility is yet to be completed. This is contrary to announcements by authorities then that it would take 30 days for this facility to be finished, so it would help in the fight against COVID-19 in the country. As the number of positive cases in Ghana begin to hit 200 per day, the attention of the public has been drawn back to this facility, which is far from complete. So where I'm standing currently is the doorway for the main entrance to the facility. Some of the plastering has been done. You can see there's space there for some of the electronic fittings in there. But you walk inside and you realize that a lot of the plastering has not been done. Now, we've been speaking to some of the workers who are here. They tell us that the crew of workers who were supposed to wire the facility came to work on the 24th, went on break, came back on the 1st of January, went on break, came back on the 7th of January, and that's the last time they reported. It's expected that they will come back to work sometime this week, and after that, after they are done with the wiring, then the plastering for the inside can be completed. There's also the roofing, which has not been completed in the inside. As you can see, the ceilings have not been fitted in. Again, we are being told that the workers who are in charge of this part of the work will do their work by this week so that the construction can continue. The empty spaces also for the doors indicate that There's still some work to be done there. We are being told that the doors are being constructed off-site, and they are waiting for those contractors to also bring in the doors so that they can fit them in. So that was the main entrance, the main arrival hall or the reception. These look like bathrooms to an untrained eye. You see the plumbing fittings in there. There are a number as well here, a number of cubicles in here. You can see this space looks like, a space for sinks. And in there, looks like space for WCs in there, about 4 of them. So, all in all, this is a facility that when operational should be able to really serve the general public. You can see there, unfortunately, some of these iron rods are rusting. It's been a while since they were planted there, as you can see. So we are looking through to really be able to report to you the extent of work that has been done here at the infectious diseases facility, which is part of the Kolebu Teaching Hospital complex. This is a 50-bed facility which has been on the books for close to a year at least when the construction officially began. When we visited here in March, the field was being cleared for the construction itself to begin. And it was expected that it should be finished in some 30 days or in the shortest possible time. Remember, more than 50,000 positive cases of COVID-19 have been recorded in the country since then. And this is a key weapon in the arsenal of government in the fight against this disease. We are speaking to some of the supervisors for the gang of workers here. They are confident that within a month all of this work can be done. But then again, they are unsure that the requisite funds will be released in time, and also that the workers will return to site so that this facility can quickly come be operational and help in the fight against COVID. As you can see, it's much larger than the current facility, which is seeing to COVID-19 patients, which is full. It's an 8-bed facility directly opposite this one. And currently, doctors there tell us that it is completely full, and they are currently treating the average of about 20 patients every single day. Most worrying about it is that 2/3 of the number of patients they treat there, according to our sources, are medical personnel, that is doctors and nurses, who are working on the front line in the fight against COVID-19 in the country. Hospital authorities did not speak to us, but we have sources who are telling us that as soon as the doors are done and the wiring is done, this is work that can be completed in the shortest possible time. The question remains about the funding that must be released from the Ministry of Health, which would, of course, be the agency acting on behalf of government to ensure that this work is done in the shortest possible time. They were unable to tell us why the work has delayed from March 2020 till now, where so many lives could have been saved, so many persons could have been treated if this facility was complete. For Joy News, this is Daniel Daze at the Kolebu Teaching Hospital.
Daniel Dazi put together that story. Let's talk to Director of Communications and Corporate Affairs at the NCCE, Joyce Afutu, who is joining us via Zoom. Madam, thank you for your time. Good afternoon. You are muted. I almost said you are zoomed. You are muted. Kindly unmute for me.
Can you hear me now?
I do hear you. Let's try this again. I've seen the statement that you issued today. In this statement, you essentially say that you are disturbed. Wrap it up for me in a summary so those who have not seen the statement can understand what your position is.
Yes, in a summary, I must say that the cases are increasing, and then the NCC is urging the citizens of Ghana to adhere strictly to the safety protocols so that we can protect ourselves and also save lives. Because we realize that the only thing or the only vaccine that we can use now is the observance of the safety protocols. That is the washing of our hands, wearing of face mask, sanitizing our hands regularly with alcohol-based sanitizer, not massing up. And if we don't have serious things going in town, we have to stay at home. So we are urging the Ghanaian populace to adhere strictly to the protocol so that we can help curb the pandemic.
Referring to, I'll just read this line. It says the NCCE urges operators of transport unions, schools, chop bar, restaurants, markets, faith-based organizations, event organizers, recreational and entertainment centers to institute and insist, which you embolden and put in caps on strict adherence to safety measures. I want to find out how the NCCE is reaching out to these organizations directly.
But we are sensitizing the general public in addition to transport owners and schools and all that. Our district and regional offices across the country are engaging with these people we've mentioned here so that they can all ensure that we observe the protocols. You go to several institutions and you realize that some of the things are there, but they are not enforcing them. So we are asking that just as we all were doing at the peak of the pandemic, we must continue to do that so that we can reduce the number of cases and the number of deaths.
The last time I spoke to the head of the NCCE right here in the studio, and she indicated to me the challenges that the NCCE has had to face trying to reach out with information because you did not have the budget. Has that been taken care of in this era?
Yeah, I must say yes, because during the COVID era in June, we reached out to the presidency and we're giving resources. The COVID-19 National Trust Fund also gave us some resources. So we're able to reach out to the citizens of Ghana with a message on the need for them to adhere to the protocols. And we all took it upon ourselves, and every Ghanaian did. But it appears that getting to the end of the year, with the easing of the restrictions, Ghanaians also gave a breather to observing the protocols. That is why we are where we are now. So we are asking that everybody, every Ghanaian, we must cherish our safety and ensure that we observe the protocols. So we have the resources, and our regional and district offices are also doing their bit with respect to sensitization.
I mean, it will be interesting for us to perhaps follow NCCE's regional and district officers to find out how they do it. Perhaps people can have, you know, an idea of how it can be improved. But give us a mental picture, since we are not there. How exactly do they do it? What do they tell people?
But what they tell people is that, you know, at the regional level, they meet at the regional capitals, visiting people that we can visit now. But with the cases rising, most of our activities, we are looking at public announcements.
Okay.
We even have our jingles and other things playing in selected media houses. And we're also reaching out to schools and artisans and the faith-based organizations. So when we go, what exactly we tell them that COVID is real? Those who think that COVID is not real, they should know that it is real, because the whole world, we cannot all not lie that nothing exists, and we are all feigning that something exists. COVID is real, and people are getting infected, people are dying. And we are telling people to wear the mask when they are stepping out of home. They should sanitize their hands regularly. They should not mask up. Yesterday, I was in Mokala, and I was talking to a gentleman who has just put the mask under his chin. So I was telling him that we should weigh the cost-benefit analysis of having to contract the disease and how we manage the disease to wearing and not contract the disease. And he said, he's up this morning, he doesn't even know, he doesn't have money to even feed. And how is he going to buy 1 CD worth of masks to wear? So I explained things to him, and then he understood me. So when we go on the ground, that is what we tell people, that the disease is real, we need to protect ourselves. We also add the need for people to also exercise regularly and also eat immune-boosting foods so that they can boost their immunity and will not contract the disease. So these are some of the things we engage the populace on.
I mean, I know that the NCC is always challenged in terms of finances, but perhaps for this guy, for a guy like that, a free mask won't be bad at all. So maybe as your officers go out, they carry some free masks as well. And perhaps we can also ask the public to support the NCC with some of these free masks that when you go to the ground, you can share with those who cannot necessarily afford it. My final question would be...
Yes, we welcome that. If people have the mask and they give it to us, we can also distribute to the populace when we go to the ground. Okay, well, okay, it's perhaps something that has just fallen on your lap that you can take it and run with it, hopefully. But my final question was whether or not you are employing the shock strategy to tell them. For the gentleman you engage, for example, who doesn't see the need and that you try to convince, you know, to weigh out the cost benefit, will you consider maybe employing the shock effect, letting them know the people that have died and maybe showing them pictures, gory pictures that can awaken their senses? Is that something you do as well? Yes, we will do that. Even we have a video at the peak of the pandemic. We did a video at the Ga East hospital, which we have. So we will show it. And we also tell people about the sanctions that are in force so that they will adhere to the COVID protocols. But what we want to add is that the enforcement agencies also enforce to serve as deterrent. We have heard, yes, we congratulate the effort of the Ghana Police Service that they have arrested some people. So they should prosecute so that others will know that, yes, if I flout the law, I'll be dealt with. And that will encourage people. I must also say that now a lot of people are adhering now, but we are not getting the whole populace doing that. So we will continue to urge Ghanaians to ensure that we observe the protocols, particularly the wearing of masks and not masking up, and also social distancing at wherever we converge, so that we will not contract the disease. Because you may not know, you can contract the disease anywhere from anyone, whether it's your family member, your work colleague, your church member, even in public transport. That is why we need to protect ourselves so that we will not contract the disease and we also protect others.
Thank you very much for joining us and for your time this afternoon. Joyce Afutu is the head of communications for NCCE. They are worried, they're concerned, and they're calling especially on schools, chop bars and restaurants, transport unions, etc., to insist that people observe the protocols before you allow them into your premise.